This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week I'm coming to you from KRMC's Hualapai Mountain campus. My guests are Dusti Yamaguchi and Rachael Sweet from Sonoran Prevention Works. They work with Kingman harm reduction. We're going to talk all about that. They work with people who use drugs. Hey, Rachael, welcome.
Thank you for having me today.
Thank you. And hey, Dusti, welcome.
Hi, thank you so much. Happy to be here.
Thank you. I've been looking forward to our conversation. We've been talking a lot on the show lately about people who use drugs, about opioids, and I'm just trying to kind of triangulate. That's the way I think about it, that I'm trying to triangulate on the story. I've spoken with doctors, I've spoken with nurses, I've spoken with Chief DeVries of the Kingman Police Department. And somewhere along the line, I think it was the chief and then definitely Terry Williams in KRMC Public Relations said, you need to speak with the folks from Sonoran Prevention Works. So here we are. Dusti, what is Sonoran Prevention Works?
So Sonoran Prevention Works is a grassroots nonprofit dedicated to ending health disparities for people who use drugs. We are engaged in outreach, education, support, advocacy for people who use drugs to help just reduce any negative impacts people might experience from drug use. We are definitely very focused on people who use drugs as being at the center of the work that we do.
Your employer is Sonoran Prevention Works, but I keep hearing the term Kingman harm reduction. Are they synonymous?
So Sonoran Prevention Works is my employer, and my department or little area is the Kingman harm reduction program, just basically running the operations of that twice a week.
Rachael, when we talk about harm reduction, what are the community benefits?
So the community benefits for harm reduction would be the decrease in transmission of HIV and HCV. Also, it keeps a community more focused on its members. It also decreases stigma for our folks who use drugs.
Part of what you do is providing clean needles for people who use drugs. Is that correct?
That would be Dusti's department. I am the harm reduction outreach worker for Mojave County. So I do street outreach. I do rapid HIV Hep C testing. I can assist with transport for any positive change that a person would like to make in their lives. And then if a person needs clean syringes because they are a person who injects drugs, they would go see Dusti. And she is at the North Country Integrated Clinic on Wednesdays and Fridays.
You said street outreach. What is that? What does that entail?
What it entails is finding people who are in active drug use or maybe they're in a period of sobriety and assisting them with basic life needs from driver's licenses to socials to linkage to care, treatment, methadone, mental health, all of those things that a person would need to make their life better.
And because many of the people you work with are intravenous drug users, of course, a major danger, side effect, or a major danger in that is the spread of hepatitis C and HIV, the potential spread, correct?
Correct, because sometimes when you're in that circle and with others who use injection drugs, sometimes people are sharing and not everybody is very careful, so it's very easy to spread with injection drug use, and the people that are in that community, they're very vulnerable. So through harm reduction, they can seek treatment and find ways to find out about their positive or negative status.
Particularly in Mojave County, there was a 2016 study by the CDC that identified our county in the top 5% of at-risk communities for a Hep C HIV outbreak. And I think that is one of the major ways that we're able to help support our community, is to keep people safer, educate them. Ideally, you're going to use a clean needle every time. If you can't, you should put a little mark on yours so you know which one is yours. If you're hanging out with a friend, they go side by side and you get them mixed up. It's like Rachael said, it's super easily spread, and that's another area that Rachel's able to help in educating people like, hey, you can get that from swap and spit or
sharing straws, dirty
razors.
needles. And Hep C also remains on surfaces of life for up to 21 days.
A lot of people think they can bleach their syringes and it's fine, let somebody else use it. Hep C isn't killed by bleach. So these are areas that we're able to help support people and educate folks.
Dusty, how do the people you work with, how do they come to you?
That's a good question. Yeah, mostly word of mouth in this community. It took a little while to kind of gain the trust of the community. I opened a year ago in May, and at first I was really excited when 10 people came in, and now we'll see anywhere from probably about 40 to 60 people a day come in. And it's definitely how, because people are faced by stigma and, there are some concerns, it is a risk to go somewhere and try and get clean needles and transport them back. People did have some concerns, and that's understandable, but just through word of mouth, treating people without judgment, and helping them get the supplies and services and referrals that they need, definitely spread throughout the community.
We've noticed that even in the category of people who inject drugs or use drugs within the community, they still want to be healthy. They still want to keep themselves safe. So that's one of the benefits of our program is we're really out there just keeping people safe and the community safe, decreasing transmission and increasing safety.
Dusty, when you say between 40 and 60 people coming in, are you saying specifically for the needle exchange?
Yes.
Yeah.
We've had 137 reported overdose reversals, so we distribute the naloxone and do trainings at the site. It takes about 2 minutes. And that way, really anyone who wants a naloxone kit is able to receive one and get the training they want.
Right. We need to, I'm sorry to interject, but we need to define naloxone in case listeners are not familiar. This is another aspect of what you do, and this is the opioid overdose reversal drug, correct?
Correct, yes. So naloxone is basically an antidote for an opioid overdose. Sonoran Prevention Works is the largest distributor of naloxone in the state. Every resident of the state has a legal standing order prescription for this medication. It is legal to carry. It is legal to administer, just kind of like an EpiPen. People can get it for another person and administer it if needed for another person.
Is there a potential risk? So, for example, if you happen upon a friend or family member who is unconscious, what I'm wondering is if there's another condition going on, if it's a diabetic coma, for example, and you don't know that, you administer naloxone, is there a potential side effect?
Yeah, that's a great question, and I hear it a lot. So the interesting thing about naloxone is it's a very safe medication, and I, as not a doctor, am able to hand it out in the community. It only acts on the opioid receptor, and it will not interfere with any other medications other than something adhering to the opioid receptor, any heart conditions, any other physical problem. The only major side effect of naloxone is acute withdrawal. For if it was the opioid, if it's not, it doesn't affect anything.
We've touched a little bit on stigma and on some of the factors facing people who are using drugs. I don't think I have to break the news to you that Kingman is a fairly conservative town in rural Arizona. Rachael, what kind of support have you seen from the community?
The community's been very helpful since we have started last May. We do partner with North Country Healthcare. They allow us to use their space on Wednesdays and Fridays, and it is with and adjacent to Mojave Mental Health. So they have also been instrumental in helping us with our participants and linking them to care. And also, Chief DeVries is on board with our program, so that also assists us within the community.
Northern Arizona Medical Group has been awesome with helping us with disposal. The county health department is really supportive of our programs. They actually got a grant for some supplies for us through MSTEP, which is the community coalition around substance abuse. And KRMC has been great.
Yeah.
They donated $500 for our program last year, and we were able to purchase some much-needed supplies for distribution.
Have you received any not support, any kind of antagonism or anything like that, or has everyone been pretty welcoming?
I am very grateful that it's been few and far between.
Yeah.
Every once in a while, I'll run into an individual that says, why are you trying to save people who use drugs? And for the most part, I come at that from a harm reduction perspective, and that's where they're at. And if they want to engage in a conversation, we're usually able to have a discussion and say, we'll talk about why it's important. We'll talk about saving lives, the financial impact of the community on the community, about 10 cents for a clean syringe versus
$94,500 for Hep C treatment.
Right.
That's pretty compelling evidence, I think.
Yeah. Dead folks don't recover, and overdose deaths are preventable. No one needs to die from an overdose, and if we're able to help support even just one person to continue to stay alive and let them know that their lives matter, if someone has resistance, they're at where they're at, but I'm able to support the people that are open to it.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Dusti Yamaguchi and Rachael Sweet from Sonoran Prevention Works. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. KRMC is pleased to announce that its new community pharmacy is now open. The pharmacy is in Suite 106 of the Medical Professional Building, 1739 Beverly Avenue. KRMC created the pharmacy to better serve patients during and after a stay in the hospital. Welcome back to Focus on Your Health. I'm T.G. Lafredo, and this week my guests are Dusti Yamaguchi and Rachael Sweet from Sonoran Prevention Works. We're talking about drug abuse in Mojave County and their efforts in harm reduction. Speaking specifically of Naloxone, if someone's listening right now and is saying, I would like to get that kit, I would like to get that training, what's the best way to do that?
So you can reach out to me or Rachael. You can visit our website, spwaz.org, and sign up for a newsletter, ask for a kit. There's a hotline that we have where you can request the kit. You can come into the site. Again, that's at the North Country office at Mojave Mental Health, 3505 Western Avenue, Suite B, in Kingman, Arizona, 86409, on Wednesdays and Fridays from 10 a.m. to 5:30, and then Rachel's there doing the testing from noon to 5.
Dusti, what is fentanyl?
So fentanyl is a synthetic opioid. It's being illicitly manufactured outside of the country for the most part, and then it's getting cut into the entire drug supply almost always before it even gets into our country. So we distribute and train people on using fentanyl test strips and encourage folks to test any substance they get, particularly if it's something that they're not getting from a pharmacy but on the street. So people are telling us there's fentanyl in heroin, there's fentanyl in meth, It's in pills. So those overdoses at the jail were from the Perk 30s, I think. I've had people come in and say my friend overdosed on a half a Perk 30 because it was fentanyl, Xanax, Coke. I got a PDF document 6 pages long from the health department just with all of these different pills that are being found that are pressed, illicitly manufactured pills, and they are being cut with fentanyl. It's really potent, and people have often ask, like, why is it getting cut into the meth or the Xanax or whatever? And it's a really good question. There's lots of theories. I think part of it is cross-contamination while it's being, packaged and distributed throughout the country before, or to go to different places in the country. I think that one of the major reasons is that because it's synthetic, it can be produced in a lab. Which makes it really super cheap. And I've had people who use stimulants tell me I had opioid withdrawals, not from like intentionally ingesting opioids. So it's literally and everything. And so that person may want to look for something actually with fentanyl. There's a lot of theories, and there's no really clear answer. But other than that, I think it's really cheap.
In preparing for our interview, I was researching, doing some work online, looking over some of your material, and I noticed a few terms that were absent, one of them being addict. I notice as we talk, we're talking about people who use drugs. There are certain things that There's certain terminology that I usually hear in the discussion of drugs that I haven't heard from either of you. And I get the feeling that is not by accident. Dusty?
So in a harm reduction, we definitely focus on person-centered language, and the reduction of stigma is a huge part of what we do. So when we use stigmatizing language, that further is oppressive for people. People already have a lot of internalized stigma, so when we put people in a box and project this idea of what we think, whatever the label might be, it really reduces the chances that people are going to go out and look for help or try and find ways to stay safer.
Yes, with person-centered language, it takes the negativity off of the person, and ultimately we just want to focus on the person, not their addiction, because people are more than their addictions. All of us know someone or have been affected by someone who uses drugs. So we just want to take the negativity away from it to focus on the person to make them better.
And it's so often seen, substance use is so often seen as a moral failing, where for a lot of people it's really meeting some kind of need, whether it's to reduce the emotional pain of historic trauma or current trauma or actual very real physical pain in this moment. It's meeting a need.
So this leads me to ask then, what is, say someone close to me who's struggling with drugs, what is the best way to help and support that person?
Support them in any way that you are able. Honestly, that question resonates for me, and I struggle with it for my loved ones, and I hear a lot of people come to talk to me about their loved ones who might be experiencing substance use, and it's really hard. People that have support always do the best. The people that I see making great strides in progressing towards something that they want to move towards, I see they have a great deal of support. And it's really hard for our loved ones because it hurts and it's challenging and it's painful. So for someone who might be experiencing a loved one going through substance use disorder, set a boundary support them in any way that you can for any positive change. Talk to them. Tell them, I want to make sure you have naloxone and you know how to use it, and I want to make sure you stay safe, because keeping those doors open is going to lead the way for whenever they're ready for a change. And then also for you to have other support. So there's groups, and you can come and talk to me and I'll hook you up with those resources. I mean, people can come to us. I think it's a lot easier for me to support people that aren't my loved ones than it is for my loved ones. So having someone else to help support you is really helpful.
I agree.
I always like to try to find out what leads people to their work. I talk to people about their jobs all the time, and I think it's really interesting. And it strikes me that the work that you do, it sounds to me as an outsider, it sounds very difficult, very challenging. And I know you're probably going to say, this isn't about you, but I got to ask, if it's not too personal, what is the calling? Why do you feel compelled to do this work, Rachael?
I feel compelled to do this work because as a peer support, I have lived experience with substance use, and I know the pain that comes with it. So for me and my healing and my own personal path to recovery, helping others is my calling, and that's what I want to do for my line of work.
Yeah, I totally agree with that, Rachael. I think most of us who work in harm reduction have what we call lived experience. It definitely supports my recovery. It is very healing for me. In a way, it is kind of very much about me. But I'm so grateful to have a purpose, to get up in the morning and feel like I am able to help serve and support other people. It makes my life meaningful. I think that's something we all need, something that gives our life meaning. So that's like a big question we all have, like, why am I here? And I'm so grateful that I'm able to help others. We're both very passionate about what we do, and I think a lot of that passion just comes from lived experience.
Well, I'm sure it will translate on the radio, because it's clear to me. And if someone's listening right now and says, how could I become involved with Sonoran Prevention Works? What's the answer to that? Is there a way that lay people can take part?
So they can go to our website at spwaz.org, go to the Get Involved tab, click on Volunteer, scroll to the bottom of the page and apply. And that's one way that they can get involved. There's many avenues of getting involved, whether it's blog writing or making kits or helping Dusti and I do street outreach or teaching someone how to use naloxone. There's many ways that a person could help with us.
Our programs, definitely donations help our organization a lot, because these harm reduction might be sometimes controversial. Any donation is very, very helpful for us to be able to further our efforts to prevent overdoses and reduce the transmission of preventable disease.
Right. Everything we do at Kingman Harm Reduction is free, so all the services that we offer the people there is all at no cost to them.
Now, for anyone who would like to either help and contribute or needs the services that you offer, what is the best way? One more time, let's go over the best way to get in touch with you or to come visit you.
So spwaz.org. You can find our newsletter, and then, like Rachael said, sign up to be a volunteer. You can stop into the site at the North Country office at Mojave Mental Health Wednesdays and Fridays between 10 and 5:30. You can call or text. My phone number is 609-755-5477.
And one more time.
609-755-5477, or my email is my first initial D, my last name Yamaguchi, at spwaz.org.
And Rachael, what's a good way to get in touch with you?
So I can be reached through talk or text at 928-514-7487. And the insurance company that we accept is Steward Health Choice.
That is Rachael Sweet and Dusti Yamaguchi from Sonoran Prevention Works. Ladies, thank you so much for your time today.
Thank you.
Thank you so much. It's been great.
And that is Focus on Your Health. I'm TJ Lafredo. Thank you so much for listening. We'll catch you next time.